Generalized Anxiety Disorder by Ashlyn Moore. Now, before diving into what generalized anxiety disorder is, let's define some important terms. Anxiety is defined as the anticipation of future threat. Anxiety is distinguished from fear, which is the emotional response to real or perceived imminent threat. Worry refers to the cognitive aspects of apprehensive expectation, and excessive worry, on the other hand, can include a multitude of different things, like negative beliefs about worry, intolerance of uncertainty, and even cognitive avoidance. Now that we have defined some of these crucial terms to understanding generalized anxiety disorder, let's get into the actual definition. Generalized anxiety disorder is persistent anxiety and seemingly uncontrollable or excessive worry that occurs more days than not for at least 6 months. Someone with generalized anxiety disorder has anxiety about a number of events or activities, and it cannot just be about one singular person, thing, or situation. I was able to interview someone who has personally dealt with this, and I asked, "Can you explain in your own words what anxiety symptoms feel like?" She then went on to explain some physical symptoms, such as feeling pressure on her chest, shortness of breath, over-exaggerated heartbeat, and sometimes a tingling sensation. As far as her anxious thoughts go, she explained them as just an overwhelming amount of spiraling thoughts. I then asked, "How do you manage your anxiety?" With which she responded, "I have to distract myself and ground myself to stop the anxious thoughts by listening to music or watching calming shows." She also added that she is now in therapy, which is a great tool that has helped her tremendously because she is now able to talk to an unbiased and non judgmental person. Talk about anxiety and its origins have been going on for a very long time now. In the Tusculan Disputations, Cicero, a well-known scholar, writer, politician, and philosopher, was one of the first to speculate on the causes of anxiety. And he wrote that affliction, worry, and anxiety are caused by disorders on the account of the analogy between a troubled mind and a diseased body, showing that there is a disunity in the mind and body, and that was seen as the cause of anxiety symptoms. From the 19th century into the 20th century, the terms used to diagnose generalized anxiety disorder included pantophobia and anxiety neurosis. The actual term generalized anxiety disorder appeared as a diagnostic category only in the third edition of the DSM in 1980, when anxiety neurosis was split into generalized anxiety disorder and panic disorder. According to Weisberg, when generalized anxiety disorder first appeared in the third edition of the DSM, the essential features were generalized persistent anxiety that lasted a month or longer and did not contain symptoms of phobia, panic, or obsessive compulsive disorder. These features were substantially changed in the revision to worry that was unrealistic or excessive, that was present for more days than not for at least 6 months, and that was about two or more circumstances. Like what was mentioned at the start of this presentation, according to the DSM, generalized anxiety disorder is persistent anxiety and seemingly uncontrollable worry that occurs more days than not for at least 6 months. The individual also must find it extremely difficult to control the worry, which leads to a significant amount of distress and can lead to dysfunction in their daily lives. The anxiety and worry must be associated with 3 or more of the following 6 symptoms: restlessness or always feeling on edge, being easily fatigued, difficulty concentrating or having frequent mind blanks, irritability, muscle tension, or sleep disturbance. Generalized anxiety disorder can manifest itself in many different ways. For example, by having an intolerance of uncertainty, beliefs about worry, poor problem orientation, and cognitive avoidance. The results from a study by Douglas showed that the most prevalent aspect of generalized anxiety disorder is the intolerance of uncertainty, which was pivotal in distinguishing generalized anxiety disorder patients from non-clinical subjects. From a biological standpoint, maladaptive responses to stressful stimuli have been observed in the nervous system, the HPA axis, and other biological systems, which may account for generalized anxiety disorder symptoms. The activation of the HPA axis is a critical part of generalized anxiety disorder, since the activation of the HPA axis is a component in normal stress responses. Researchers hypothesized that baseline plasma cortisol levels may be elevated in generalized anxiety disorder patients, causing their HPA axis to overreact to stimuli and causing the symptoms of generalized anxiety disorder. From a psychosocial or environmental factor standpoint, some interesting data was found by Safran and his colleagues, which stated that patients with generalized anxiety disorder had intermediate rates of past physical or sexual abuse that have been shown to maybe have influence in the development of this disorder, given their past experiences of traumatic events. Additionally, generalized anxiety disorder patients with a history of childhood abuse were also more likely to have comorbid major depression than those without. Some other factors that need to be taken into account when discussing the etiology of generalized anxiety disorder are daily environmental stressors, such as work, school, or stressful relationships, socioeconomic status, and having a lack of social support. Without any social support, people have no one to lean on to or talk to when they get overwhelmed, leaving all of that pent up negative, anxious energy and emotions inside, which is certainly not healthy for any individual. There are a lot of psychological components that go into the etiology of generalized anxiety disorder. From a cognitive perspective, there is a belief that negative cognitions are leading to the interpretation of worry as uncontrollable and harmful. This cognition makes worry problematic because it is now negatively appraised, which can lead to an increase in generalized anxiety disorder symptoms. Increased anxiety sensitivity is another part of generalized anxiety disorder, which is characterized by a fear of arousal related bodily sensations due to beliefs that these sensations are signs of impending catastrophic physical, psychological, or social outcomes. Having an increased anxiety sensitivity is common in generalized anxiety disorder and is very difficult to overcome because it calls for a change in one's cognitions. Also, those with generalized anxiety disorder generally exhibit an impaired attentional control, in which anxious individuals preferentially attend to threat related stimuli in the presence of neutral stimuli. And it is often the case that those with generalized anxiety disorder have difficulties shifting their attention away from their worrisome thoughts and are therefore not able to instead focus on other topics or tasks. This is because anxiety impairs normal functioning attentional control, which is a key function of the central executive. From a psychodynamic perspective, Freud believed that anxiety resulted from pent up, repressed, unrelieved sexual tensions from the libido, and this blocked energy from the libido was then automatically transformed into and displayed as anxiety and its correlated symptoms. From a behavioral perspective, early learning histories, temperamental vulnerabilities, and learned or conditioned contextual variables and responses during and following stressful learning events can greatly affect the course of generalized anxiety disorder symptoms. From a humanistic existential perspective, anxiety results from having an intense awareness that one's existence can become destroyed, or from the realization that our fundamental drive towards the reaching of one's potentiality is blocked or thwarted. Generalized anxiety disorder is a common and disabling illness that is often underdiagnosed and undertreated. Patients with generalized anxiety disorder are at an increased risk for suicide as well as cardiovascular related events and death. According to Stein and Serene, first line treatments for generalized anxiety disorder are cognitive behavioral therapy or pharmacotherapy with selective serotonin reuptake or serotonin norepinephrine reuptake inhibitors. Similarly, in many studies done worldwide, cognitive behavioral therapy was found as the most effective in the treatment of generalized anxiety disorder. And cognitive behavioral therapy has also been considered a, to have positive effects on depression that can sometimes be associated with generalized anxiety disorder. Cognitive behavioral therapy is very helpful for those with generalized anxiety disorder because it can help target and replace negative cognitions associated with the disorder and replace these cognitions with more realistic and positive cognitions to lessen anxiety symptoms. Predictors of the course of generalized anxiety disorder include things like status of relationships, the presence of comorbidity, and gender. Poor relationships, whether that's with a partner, a spouse, relatives, friends, etc., and the presence of comorbid cluster C personalities, such as avoidant, dependent, and obsessive compulsive personality disorders, have been closely associated with a reduced likelihood of generalized anxiety disorder remission. In regards to gender, according to one study done by Bolin in 2020, it concluded that more women in comparison to men experience higher levels of anxiety and show different patterns of co-occurring mental disorders. Additionally, this study also found that generalized anxiety disorder severity was negatively associated with the number of personal resources and physical health, meaning that a higher number of personal resources and better physical health was shown to be associated with lower generalized anxiety scores. These results show that socioeconomic status play an important role in the development of generalized anxiety disorder, which makes perfect sense because with low socioeconomic status comes more everyday life and environmental stressors. The Bible talks about anxiety many, many times, and most of those times it informs Christians that they should not excessively worry about their lives. Take Matthew 6, verses 25 through 34, for example. When Jesus was giving his Sermon on the Mount, he says, quote, "Do not be worried about your life as to what you will eat or what you will drink, nor for your body as to what you will put on," which is Matthew 6:25. He then goes on to explain God's provision for the birds of the air and the lilies of the field, demonstrating how much more that God will provide for you, his child. Jesus then concludes this sermon by saying, quote, "So do not worry about tomorrow, for tomorrow will care for itself. Each day has enough trouble of its own." Matthew 6:34. The takeaway from this is that we need not to fear because of God's character and his promises to take care of us and provide us with our needs and what is truly best for us. Biblical counseling can also be a great tool to use when combating the symptoms of generalized anxiety disorder, and learning to place your full trust in God with your life and everything in it is the first and most difficult step.